We're going to go on item 6.5, 9:45 a.m., consideration of annual report of the Maternal, Child, and Adolescent Health Advisory Board. Please come on up to the front, take a seat, get comfortable. Good morning.
Good morning, Board of Supervisors. My name is Samantha Bond. I'm the Executive Director for First 5 Lake, and I happen to be the Chair of the Maternal, Child, Adolescent Health Advisory Board. I'm joined up here with me do you want to introduce yourself, actually?
I'm Alex Kellner. I'm the Maternal, Child, Adolescent Health Coordinator for the program for the County Public Health Services.
Sabrina Andrus, Executive Director of Otherwise and Board Member of MCAH.
Push the button.
Yeah, I didn't push that.
Soledad Aguayo, Early Intervention Supervisor with Easter Seals and...
I apologize, I don't think that's working.
And Board Member.
Sabrina Andrus with Motherwise. She's a board member for the advisory board, as well as Soledad Aguayo from Easter Seals is also a board member. So I want to just kind of say that this advisory board hasn't been in front of the Board of Supervisors in quite a while. We do recognize that. We've had a lot of shifts and changes in not only the advisory board, but the MCAH staff themselves. And so it's been quite a bit. As most of us know, COVID kind of changed the trajectory of where a lot of things were going. So we've had a lot of rebuilding that we've been doing. So to start, I would like to just kind of give an overview as to what is MCAH and then what is the advisory board. So MCAH is a federal and state-funded public health program designed to improve the health of women, infant, children, and adolescents. Our key focus areas are prenatal and postpartum care, infant and child health services, including breastfeeding, immunization, and checkups, adolescent health. Some examples are sexual health education and mental health support, family planning and reproductive health, and home visiting services. For this advisory board specifically, our role is to advise the Lake County MCAH staff, the Department of Health Services, and the Board of Supervisors on the needs of the communities, the action of the advisory board, and the recommendations to MCAH staff. Our purpose is to promote and advocate for the physical and social and emotional health of pregnant people, children, adolescents, and their families in Lake County by sharing resources and coordinating activities. We've worked extensively on these 4 high-level goals, and then we have some sub-goals that we've worked on throughout the years. So we increase public awareness on health concerns and challenges pertaining to pregnant people, children, adolescents, and their families, support ongoing efforts towards building coordinated and effective healthcare delivery systems, promote access to healthcare for pregnant people, children, adolescents, and their families, and identify and advocate for unmet health needs. Our board members consist of myself as the chair, Soledad as the vice chair, Nicole Query from Partnership Health Plan, Sabrina Andrus from Otherwise, Rachel Dimon Parsons from Social Services, who's in the back there, and Kim Schott from WIC. We also have members of the public who attend very regularly, and so their agencies are listed here if they are outside of the board themselves. So we have members from Adventist Health, First 5, Health and Social Policy Institute, Hope Rising, Behavior Health, Public Health, Social Services, Tribal Health, Lake Family Resource Center, and Redwood Community Services. We are hoping that this list continues to go on and gets extensive as we go along, but right now that's who we have for the last year. I made it mad. Let's go back. Okay, it's looking funky, but it's fine. So again, I want to mention that over the last 2 years since I've been chair of this advisory board, we have looked at what is this board, and what do we want to accomplish, and where do we want to be? And so we've done a lot of internal work. So we did a lot of work around our bylaws. In fact, we spent an entire year on our bylaws, and realized it the bylaws we were operating under in January of 2018, excuse me, were not actually approved by the Board of Supervisors, but we were operating under them anyway. So we got those fixed up and redone, and we did get them approved by this Board of Supervisors back in January of this year. We also worked to rebuild the board. At the start of the year, we only had 3 board members, so we doubled. So I'm going to take that as a huge win. And then we increased our community engagement. And those 2 things we're still continuing to work on as we move forward. We really do want to have more people attend, and we really want to have more people giving their voice. For the members of the public, we do allow it to be virtual, so they can join us via Zoom, but all board members do attend in person, as it is a Brown Acted meeting. We also worked on a home visiting collaborative, which is a standalone subcommittee. Back in 2019, the MCAH staff had taken on a grant from First 5 California to uplift a home visiting program here in Lake County. Unfortunately, due to COVID, that didn't happen right away, and it wasn't unique to Lake County, but First 5 California decided to take a look at that grant and decided that instead of working directly with MCAHs across the state, they wanted to work just with First 5s and do a more regional approach and more of a technical assistance approach. So First 5 Lake did take over that grant, and we did take over the home visiting collaborative, but I will say that the MCAH staff has worked on for the last 2 years uplifting their Healthy Families home visiting program. It took them about a year to get all of the trainings and documentations, which was very extensive, to get that up and running, and they are seeing quite a bit of clients now. We also looked at one of the questions we had in that group was what is home visiting and what is versus home-based services, especially when we're looking at the younger population. And so we've worked on defining what home visiting is. We've worked on the CalAIM initiative and understanding those changes, and I can tell you that we still don't know. It's an ever-learning process, and we're still learning it. And then we wanted to bolster our relationship with Partnership Health Plan. As you may have noted, we have a Partnership Health Plan member as our board member, and so she has worked really, really heavily with us to coordinate other Partnership Health Plan departments to help us get that understanding around CalAIM, understanding of how we can collaborate and connect more. And we actually have a lot of Lake County information on their websites. And then what I gave in front of you is the needs assessment. So every 5 years, the MCAH staff has to conduct a needs assessment. It should be no surprise to this board that the needs assessment highlighted poverty, access to care, and substance and mental health use supports as some of the highest needs within our communities. So those are some of the focus areas that staff has identified and are working towards on their scope of work. We also restarted the Breastfeeding Coalition. It had kind of dwindled down during COVID, and we tried to do it as a standalone subcommittee, but realized that we weren't getting the attendance that we needed and weren't making waves. So we kept it as a standing item for the MCAH Advisory Board. Since then, we have been able to look at what were some of the things that we've done in the past that we want to look at, or that we want to continue, things that we want to look forward to in the future, and where can we start today. So one of the things we talked about was the comfort station at all local events, or most local events, I should say. So the comfort station is a pop-up tent that happens at events where any member of the public can come and sit in one of the really comfortable rocking chairs and either breastfeed, bottle feed, or just rock a toddler who's grumpy because they're standing out there in the heat. We are in the process of looking at replacing our diaper changing station, which we don't currently have right now. And then in certain areas, we actually have built environments. So for example, if there's an event happening on Main Street, Lakeport, Motherwise has opened their doors as a internal comfort station versus setting up the pop-up tent, which is a little bit more comfortable. We also have a place in Kelseyville that also does that for all their events. And so we're looking at some other places around the lake to do the same. But for areas that maybe can't have access to a built environment, we have the comfort station that we popped up. And we just had it at the health fair this past weekend. We also updated our logo, And after we do our logo, we're going to update flyers, signs, and educational materials. But this is our brand new logo for our Breastfeeding Coalition. And we're very excited. So if you see this in the community, that means it's a breastfeeding, bottle feeding, family-friendly area that you can come and visit and find out more information about. So that's what we've been up to for the last year. Looking forward, we have some state priorities that MCAH has to kind of look at. These are just their high-level pieces. They have the 5 buckets, which is women and maternal health, perinatal and infant health, child health, children and youth with special health care needs, and adolescent health. And basically all of those things underneath of it say, ensure that they're healthy, happy and healthy. So that's kind of where we're at with our goals. So I kind of told you our 4 high-level goals that we put within our own. It does mimic these. It's just not in the same buckets. And then we, as a collaborative, went, or as an advisory board, talked for several meetings about what do we want to do to support MCAH staff and to bolster these objectives within our community. And we highlighted these focus areas. So we want to bring local trainings to parents and providers, especially around harm reduction and breastfeeding supports. Substance use during pregnancy and breastfeeding. There was an ask for a lot of information around that and being able to get that out. Addressing access to care, specifically for us, that would be doulas, midwives, and OBs. And this will help address and reduce birth disparities here in our community. Providing community and with more safe sleep information and SIDS awareness. We actually just had Adventist Health come to the advisory board and present their safe sleep information that they present to their clients. It is a mimicked presentation at Tribal Health. And then I'm not sure about Sutter. They did have a safe sleep class, but I'm not sure that it's currently happening, but that is something on our awareness and agenda. Additionally, we also talked about where else in the community can we do safe sleep information, and child care was brought up, so home-based child care. And then MCAH staff themselves are working on their curriculum for first responders to give them more information around SIDS awareness for first responders. We also want to increase access to screening and supports for maternal mental health. I'll tell you that Motherwise is taking a huge point on this, and so we'll have a 3-year projection plan around this. I'm very excited about that. And then we want to continue our board recruitment. As I mentioned, I would love to have a board of supervisors actually sit on our board, if possible, if not as a member of the public. We did have one in the past that was attending. It is not a requirement of this board, but it is an ask that we do have. So key takeaways are that MCAH programs play a critical role in improving family health outcomes. Our local efforts are essential to addressing health disparities and improve access to care, and that the continued support and innovation will drive future success. And that support is both from the Board of Supervisors as well as from the public to come and help us learn what we don't know. Our board meetings meet every second Thursday of every month from 9 to 10:30 at the LCOE Learning Lab. We are staying in Lakeport because we found that that's the best place for us to get attendance. So it's pretty stagnant right there. And then you can always email us at first5@lakecountyca.gov if you want to be invited to those meetings. And that's it.
Thank you for your presentation. Any other comments? All right, questions or comments from board members? Supervisor Green?
Yeah, thank you for the presentation. I'm very excited. I know it's been a little while since this report happened. I have another committee which I'm hoping to get goosing up and get some reports to the board. When you're advisory to the board, it's nice to hear from you. One super quick question. Is this a statutory committee, a creature of the legislature and the board appointments and all that, or in support of that? And I haven't read through your bylaws, I apologize. So just a little additional detail on process and how MCAH exists both in state law and how we deal with it here on the board level.
It is. MCAH actually stems all the way back to child labor laws and has morphed throughout the years, obviously, to be more health-based. The advisory boards are Brown acted. We do have to be appointed by this board. And so, yes, to answer your question.
Okay. Great. Well, I appreciate everything you've presented. A year-long deep dive into the bylaws is not a fun thing for anybody, but I appreciate it. It gives structure and it supports your mission and will give future board members some clarity that will be helpful. Thank you for that.
Supervisor Pyska?
I appreciate the invitation for someone from this board to be added to your board, and we are doing board assignments in the first week of January. So if you want to get that information to the admin office, then we can put it on the list when we start filtering through those in the next few weeks.
So I do have a question. First off, thank you for the presentation. I see a certain amount of overlap between MCAH and First Five, a certain level of overlap. I know that you said that you were really happy. You've grown your membership over the course of the past year from 3 to 6, but I know that in First Five, we still struggle to meet the overall membership. We have vacancies, therefore it makes it a little bit difficult sometimes when we can't meet quorum. Is there a way to maybe connect the two together so it's kind of like one meeting after the other where there can be some similar membership between First Five and MCAH to help? Just because there's that overlap and obviously staff member similarities, and just kind of wondering if that might be a way to find which supervisor to place on the advisory board and also ensure that membership is easier since it's similar membership from one group to the next rather than two completely separate ones. Just a thought.
It's an interesting thought. I don't have an answer to that other than we do have our own statutory requirements around who can be on the First Five Commission, which is different than who can be on the MCAH. We have a lot more broader reach for MCAH Advisory Board. There are a lot of similarities. I will agree with you for that. And First Five also looks at not just the child health, but also looking at the development of them. And we're very niche within the 0 to 5 range, whereas MCAH is prenatal through 18.
That was my next question, was adolescent. Describe the age group, so all the way to 18.
Yeah.
It was just a thought, just because I think we're seeing that same difficulty in membership in other advisory boards, and if it's possible to go 2 to 4 or 2 to 3, it's not always an hour for First Five, and then 3 to 4 for MCAH. That way, it's just one block of meetings rather than all separate. And anyways, just putting it out there as a possibility. But I agree. In January, we redo our appointments, and I think this would be a good one to make sure to have a supervisor on there. I think it's good for us to be involved, so we're not just aware, but we bring back stuff to the Board of Supervisors. It's easier done that way.
I have a question on timing. So if, for example, the MCH board discusses this and we decide it is a good idea to sort of stack the two in terms of meetings, when would you guys need to know that in terms of appointments for supervisors on various boards, commissions, et cetera?
I think it would be easiest to know by the January date so that we can organize who's going to make what meeting so we don't overlap it with other meetings.
Okay.
I would submit that to the admin office by the beginning of December.
December. Okay.
That's when we start circulating.
Perfect. Thanks.
You're welcome. Any other comments? Let's go ahead and open it up for public comment regarding this presentation and the ask. And I see no one in the chamber and no hands in the Zoom room. So I feel like we should be taking some kind of action today because we don't have an appointment from the Board of Supervisors at this moment in time. Do we need a motion today to say we want that to be added and be active as of January? Because we don't have a seat to appoint to at this moment in time. What's the process that we need to follow to make sure that we're ready in January?
We don't have an action on the agenda, though.
It does say appointment.
It says at the bottom, no action.
Really? I just opened it. I thought it said appointment.
Yeah, it says
Oh, did they change
presentation
it?
and possible appointment.
County Council, please.
So,
Somebody help me.
what your board suggested can be done by direction of staff by consensus to to create such a position for purposes of appointment.
Okay, and then the appointment itself will be made and approved by the board in January, as discussed. Okay. Is that, looks like I'm getting 3 nods, 4 or 5, so unanimous nod that yes, please add a supervisor to the list, and then we will get that appointment done in January.
Oh, wait, how many members do you have now?
We have 6 members right now.
That would be 7.
It actually makes it that much better. Perfect. Well, thank you very much for your time today. Thank you for your presentation, and keep up the
you.
good work. Important work.